Hi pregnant moms, this is Dr. Burke-Galloway, author of A Smart Mother's Guide to a Better Pregnancy, blogger and OBGYN physician. So today I want to talk about stillbirths, a death of a baby that happens while the mother is still pregnant. Very devastating. The question is, can it be avoided? Well, I'll let you answer that while I share the story with you. Okay, so I had a patient who was 36 weeks, first baby, no complications, everything is going well. She comes into my office for a routine exam. We measure the baby, we listen to its heartbeat. Heartbeat is fine. She's getting ready to walk out the door, and I ask the magic question. By the way, you feel the baby moving, yes? She said, you know what, I haven't felt her move a lot all day. Now, many of my colleagues, especially if they have a busy practice, you've got a lot of patients out there waiting to be seen, they would have blown her off. They would have said, you know what, everything's okay. I heard the heartbeat, baby's fine. You probably need to eat, go home and eat, and I'm sure things will be okay. I'll see you next week. I don't practice medicine that way. I knew that if she didn't feel the baby move a lot, we need to find out why. So I sent the patient to labor and delivery and asked the nurses to do a non-stress test. She got to the hospital, they did the non-stress test. Non-stress test is where they put a belt over your pregnant belly. They ask you to click when you feel the baby's heart. They ask you to click when you feel the baby move. And she wasn't clicking the machine a lot because she wasn't feeling the baby move a lot. So the hospital then, because she wasn't clicking the machine, had to do the next step, which is to order an ultrasound. Ultrasound was done and it showed not a lot of fluid, so they opted to do a C-section, the doctors who were on call. When they did the C-section, they discovered that the umbilical cord was wrapped not only around the baby's neck, but also around its entire body. That is the perfect storm for a stillbirth, because the oxygen that the baby receives comes from the umbilical cord. And if the umbilical cord is squished because it's wrapped all around the baby's body, the baby is not going to breathe, and if the baby can't breathe, ultimately it will die. So we have a very happy ending to what could have been a very sad story. So, can a stillbirth be avoided? Yes, it can sometimes if you're paying attention. I hope that you've enjoyed this story, that you've gained something from the message, and that you will pick up a copy of The Smart Mother's Guide to a Better Pregnancy at my website, www.smartmothersguide.com, because even if your midwife or your doctor misses a warning sign about your pregnancy, you won't. Until next time, have a happy pregnancy, and remember, a healthy pregnancy doesn't just happen, it really takes a smart mom who knows what to do.